Hello and welcome to Live Parkinson's, Live an Exceptional Life. I'm your host, Chris Custenbotter, and I've been living an exceptional life with Parkinson's for the past 14 years. The mission of this podcast is to help as many people as possible with Parkinson's to lead a great quality of life. Today's topic is navigating Parkinson's, exploring medical marijuana as a treatment option. Did you know that nearly 10 million people worldwide are living with Parkinson's, and it's the second fastest growing neurodegenerative disease behind Alzheimer's? As current treatment options face limitations, many people are turning to medical marijuana for potential relief. Now let's explore the science behind this emerging therapy. Just for the record, I have never used medical marijuana, and I'm neither promoting its use nor looking negatively at people who use it. That's a personal discussion between you and your doctor on whether it's appropriate for you. Now, the reason I wanted to discuss medical marijuana is it's been a hot topic in the news, and it's one of the topics that often gets discussed at Parkinson's conferences, or sometimes you hear it in support groups as well. So I wanted to look at the science behind it and how it works, and then also explore some of the current research on medical marijuana for Parkinson's, and then look at what some of the potential benefits and drawbacks are for its use. Now, I do know several people personally that do use medical marijuana for managing pain or anxiety, and they said they get really good results with it. So here's what we'll be covering in this episode. First, I want to cover some of the current treatment options for Parkinson's, including medications and surgical procedures, and then discuss the potential drawbacks or side effects of existing treatment and the potential need for alternative approaches. Then we'll move into the nitty-gritty of the podcast and discuss the science behind medical marijuana. We'll look at cannabinoids and the endocannabinoid system. And I'll explain the role of cannabinoids like THC and CBD in the human body and how they interact with the endocannabinoid system. Then I'll discuss some of the current and existing research on the use of medical marijuana for Parkinson's, including studies on its effectiveness in managing symptoms. Then I'll discuss some of the potential benefits for medical marijuana for Parkinson's, such as reducing tremors, improving motor function, and managing pain. Then I'll move on to look at some considerations and concerns. I'll discuss dosing and administration, potential side effects, and then we'll close it out with legal and regulatory issues. So if you're ready to learn more about the use of medical marijuana, then join me on this journey of discovery. Now, before we dive in and look at current medications and therapies for Parkinson's, I wanted to share some statistics on medical marijuana in its use for Parkinson's. And the reason I wanted to do that is so that we can understand how prevalent its use is for Parkinson's and what people are typically using it for. What symptoms are they trying to treat? And then that way we can compare this then to its general use in the general public. So let's look at some statistics. Let's start out with prevalence. Now, this data comes from the Parkinson's Foundation and their article, Parkinson's Foundation Releases Results of First Ever Medical Cannabis and Parkinson's Disease Survey. They found that 25% of people with Parkinson's disease reported using cannabis within the previous 6 months. They also learned that more than half of the users learned about cannabis from the internet or friends rather than from healthcare providers, which hopefully we can change that paradigm so that people are getting the information from their healthcare providers. In their article, Medical Marijuana, again by the Parkinson's Foundation, they state that only 10% of physicians have recommended cannabis to their patients with PD, despite 80% of the patients having used it. This is one of the reasons I wanted to discuss this topic as well, because the data is showing a big disconnect or discrepancy between physicians' views and patients' views. And we're going to talk about why there's such a big discrepancy as we move through the podcast. I think you'll find it a little bit enlightening. Let's look at some statistics on what is being used for in Parkinson's. In an article in nature.com titled Weeding Through the Haze, a survey on cannabis use among people living with Parkinson's disease in the U.S., the data from the survey that I'm going to talk about is based on 1,064 individual surveys that were returned from 49 states, with the average age of the survey respondents being 71.2 years old. And they had a mean PD duration, meaning they've had Parkinson's for a mean of almost 7.5 years. Now, the study asked if they had used medical marijuana or cannabis in the last 6 months. Most of the respondents, 75.5%, did not report using it within that time period. Then they asked the survey respondents to identify 3 reasons why they're not using cannabis, and the most frequently identified reasons for not using medical marijuana or cannabis included lack of evidence of the efficacy of cannabis, that was 60%, fear of cannabis side effects, 35%, and other reasons were 31%. Then they were asked to select up to 3 reasons that might influence them to consider using medical marijuana or cannabis. Now, the majority of the non-users, 76%, indicated that if there was evidence that supported the cannabis use for PD, that it would be most influential and help them with making the decision. The other considerations that they mentioned were the healthcare team encouraged its use, and that was about 55%, or cannabis side effects were better understood, which is 35.5%. Now, in the article, the most common non-motor symptoms that cannabis users were trying to treat were anxiety, 45.5%, pain, 44%, and sleep disorders, 44%. So typically then the 3 main conditions that people are trying to treat with medical marijuana: anxiety, pain, and sleep disorders, all of which are fairly prevalent in people with Parkinson's. Now, in the general population, cannabis use is a little bit more widespread, with 18 states and Washington, D.C. legalizing recreational use, and then 38 states plus the District of Columbia allow medical use. All right, now that we've looked at some statistics and some of the data on medical marijuana's use, let's look at some of the commonly used drugs and drug categories used to treat Parkinson's motor symptoms. And the reason I want to do this is that way we can talk about the benefits they provide and then the potential drawbacks, and is there a need for alternative therapies. Now, starting it off with carbidopa-levodopa. Levodopa is the most effective medication for PD. It's converted into dopamine, which is a neurotransmitter, in the brain, and it helps control our movements. Carbidopa is often combined with levodopa. So, example, you might have heard of Sinemet. And the reason they combine it is to prevent its breakdown before reaching the brain and then helping reduce its side effects. Like one of the big ones is nausea. Then we have the dopamine agonists. These drugs aren't converted into dopamine, but they mimic dopamine effects in the brain and include Mirapex, Requip, and Neuropro. I personally take carbidopa-levodopa and a dopamine agonist, and they can be used together. All right, next up is MAOB inhibitors. Now, these inhibit the enzyme monoamine oxidase B. Ooh, that sounds like a mouthful, which breaks down dopamine in the brain, and thus it increases the dopamine levels. So, examples would include selegiline, Azilect, and Xadago. Now, moving on to COMT inhibitors. These drugs block the enzyme catechol-O methyltransferase, which breaks down dopamine, thereby prolonging the effect of levodopa. That was quite a mouthful, but I think I managed to get through it. Some examples would include entacapone and tolcapone. Finally, we have the anticholinergics, and they're used to treat and control tremors and muscle rigidity. Examples would include cogentin and Artane. Finally, amantadine, which is another drug I take, is originally an antiviral drug that was used to treat influenza or the flu. And it can help reduce involuntary movements or dyskinesias that are caused by levodopa. Now, these medications are often used in combination to manage symptoms effectively. So they might take levodopa, a dopamine agonist, and one from another category, and combine those to give you the best possible outcome in terms of symptom relief. So it's essential that you work closely with your healthcare provider to tailor a treatment plan to your individual needs, and then you want to monitor the side effects. So if you can let your doctor know what the side effects are, they can adjust your medication or make replacements. All right, now let's briefly look at some surgical options for treating Parkinson's. The most commonly approved surgical procedure for Parkinson's is deep brain stimulation, or DBS, which most of you have probably heard about. And let's talk a little bit about how it works. So essentially, a surgeon implants electrodes into specific areas of the brain, such as the subthalamic nucleus or the globulus pallidus. The electrodes are connected to a small battery-powered generator or a stimulator that is then implanted under the skin near your collarbone. The stimulator sends electrical signals to the brain to help regulate abnormal activity and to help improve your motor symptoms. DBS can help improve motor symptoms such as tremor, rigidity, and slowness of movement, or bradykinesia. It can also reduce the need for certain medications, which can help lead to lower side effects. So if you don't have to take as much medication, you hopefully don't have as many side effects as well. Other less common surgical treatments for Parkinson's include a pallidotomy, which involves destroying a small part of the globulus pallidus, which is a region of the brain involved in movement control. The second is a thalassectomy, which involves destroying a small part of the thalamus, a region of the brain that helps relay sensory information. Okay, I might have butchered those a little bit, but those are two of the other ones that are available as well. Okay, so why did we discuss existing treatments and surgical procedures if this podcast is on medical marijuana? Well, that's a fair question, because I wanted to share what's currently being used to treat Parkinson's and now briefly discuss some of the limitations of the current treatments and why people are looking at or using alternative therapies like medical marijuana for treating their Parkinson's symptoms. Now, let's look at some of the drawbacks of the common treatments and then turn our attention to medical marijuana. Sound fair? All right. Well, the current medications we discussed are effective in managing Parkinson's symptoms. They do come with potential drawbacks and side effects. For instance, levodopa, which is one of the most commonly used medications for Parkinson's, can have side effects including nausea, vomiting, and dyskinesias, or involuntary movements, and can also lead to wearing off. MAO-B, COMT inhibitors, and dopamine agonists can also cause side effects like hallucinations, dizziness, insomnia, and gastrointestinal problems. DBS, of course, the surgical option, can be highly effective, but it comes with risks as well. There's the risk of infection, brain bleeds, and some cognitive side effects. All right, can alternative therapies help? Well, first, they can complement traditional treatments, helping to manage your symptoms and improve your quality of life. Now, alternative therapies may also help to reduce the side effects of traditional medications, and they can also help address any underlying causes. Certain alternative therapies may improve your overall well-being, including both your mental and your emotional health. Okay, so now that we understand the current treatments for Parkinson's and their potential side effects and how alternative therapies may help, let's look at an alternative therapy and the focus of this podcast, which is medical marijuana. And first off, I want to talk about what exactly is medical marijuana and how is it different from regular marijuana, which is often referred to as recreational marijuana. Well, medical marijuana is also known as medical cannabis, and it's used specifically for medical purposes and requires a recommendation from a healthcare professional. According to the article, What's the Difference Between Medical Marijuana and Recreational Weed? It was written by Stacia Woodcock. She's a PharmD, and she states that millions of people in the U.S. currently use medical cannabis for conditions like epilepsy, multiple sclerosis, and nausea from chemotherapy. She also notes that chronic pain seems to be the most common reason people turn to medical cannabis. The article refers to a 2020 survey of over 9,000 people where respondents said anxiety, insomnia, and depression are also common reasons for using it. Now, other conditions that people use it for include post-traumatic stress disorder, Parkinson's disease, Alzheimer's disease, Huntington's disease, and irritable bowel syndrome. Okay, so what's the difference between medical marijuana and recreational use? Well, medical marijuana often has higher levels of cannabidiol or CBD. And CBD is the non-psychoactive component, and it provides the therapeutic benefits without the marijuana high. Now, recreational marijuana typically has higher levels of tetrahydrocannabidiol, or THC. And THC is the psychoactive compound that produces the high that people look for. Medical marijuana is available in various forms such as oils, tinctures, capsules, edibles, and topical creams. Let's look at how CBD, the non-psychoactive component, and THC, the active psychocomponent, act in the human body by interacting with a system known as the endocannabinoid system. So we'll just call it ECS to going forward so that I don't have to keep saying endocannabinoid system. All right, first of all, cannabinoids are chemical compounds found in the cannabis plant. And the two most commonly known cannabis compounds are the tetrahydrocannabinol, THC, and cannabinol, CBD. And these two compounds are going to act with the body's endocannabinoid system. And what that is you're saying, what is that? Well, believe it or not, it was actually found or discovered in the 1990s, so really not that long ago. Essentially what it is, it's a complex network of signaling receptors. And the way I like to think about it is, to help picture it in my mind, is that I look at it's a network of signaling receptors. So I thought of cell towers. That's the network. And then there's signaling molecules, and that would be your cell phone calls. And they're found throughout the body. So what it does is it plays a crucial role in a lot of different body functions and processes in our body, including pain. The ECS helps regulate pain perception. Another thing it does is mood. It influences our mood and emotions, and it plays a role in appetite regulations. I think that's why you hear people who are using recreational marijuana say they get the munchies. The ECS also affects memory and learning and sleep. It's involved in our sleep-wake cycles. So it's interesting to note that the endocannabinoid system was discovered just not that long ago, about 30 years or so ago. And it has really three main components. And I'll try to make this as easy as possible. There's the endocannabinoids, and they're just the molecules that are produced in our bodies that are similar to cannabinoids found in cannabis. So we actually produce these cannabis-like molecules or compounds in our bodies that the endocannabinoid system uses. And then the second component is receptors, and there are really two main types of receptors found throughout the body. There's one called a CB1 receptor, and these are primarily located in the central nervous system, which would include your brain and your spinal cord. And then the second is CB2 receptors, and they're mostly found in the peripheral nervous system, especially in immune cells. Now you're probably thinking to yourself, what is the peripheral nervous system? Well, that would be the nerves that run from your spinal cord out through your body, you have the nerves running down your arms and legs and back. So those would be part of the peripheral nervous system. And then finally, you have enzymes. And what these enzymes do is they break down the endocannabinoids once they have fulfilled their function. So the enzymes then will break it down and get rid of it once they're done with it. So the three main components are the endocannabinoids, which are, again, they're molecules that are produced by our bodies that are similar to the cannabinoids found in cannabis. And then the two receptors, CB1 in the central nervous system and then CB2 are in the peripheral nervous system. And then you have the enzymes. So here's how THC and CBD interact with the endocannabinoid system. Remember, THC is the primary psychoactive in cannabis. It binds to both CB1 receptors in the brain and spinal cord, and CBD2 receptors, which are, again, found in the peripheral nervous system in other parts of the body. However, and this is kind of a key, THC has a stronger affinity for CB1 receptors in the central nervous system. So it's going to be attracted to those receptors in the spinal cord and the brain. So THC has a stronger affinity for the CB1 receptors, and this interaction with these CB1 receptors in the central nervous system is what produces the high associated with using cannabis. By binding to the spinal cord and brain receptors, that's going to produce the high that's associated with cannabis use. Now, according to the article, Endocannabinoid System, Essential and Mysterious by the Harvard Health Publishing, they say that THC can affect various functions such as your mood, memory, pain perception, and appetite. CBD, unlike THC, that does not produce the high because, remember, it doesn't have the psychoactive effect. It has a low affinity for both CB1 and CB2 receptors, but it can influence the endocannabinoid system indirectly. CBD can inhibit an enzyme which breaks down and leads to an increased level in the endocannabinoid system in the body, and this can result in various therapeutic effects, such as reducing inflammation, alleviating pain, and decreasing anxiety. Now, it is important to note the effects of cannabinoids like CBD and THC on the body are dependent on several different factors. And some of the factors would include the type of cannabinoid. THC is going to produce the high because it's going to bind to the receptors in the brain and spinal cord, and CBD because it has a different effect and doesn't produce the psychoactive effects. Dosage, the amount of cannabinoid consumed affects the intensity and duration of the effects. So it's like with anything, the more you take, it could make the intensity stronger and make the duration longer as well. And then individual effects are another factor. And things like your age, genetics, and your tolerance can affect how a person responds to cannabinoids. All right, my friends, that's how the two most common compounds of cannabis interact in our bodies. Now, so that you're equipped to answer any questions during conversations, and people might even think you're a doctor with all of that knowledge, it's now time to look at the research on medical marijuana for Parkinson's. So let's start with medical cannabis as an alternative therapeutics for Parkinson's disease, systematic review. So this is a study that was published in the journal Complementary Therapies and Clinical Practice. And the objective of the study was to evaluate the efficacy of medical cannabinoids in appraising the quality of evidence from clinical studies. So what they wanted to do is look at a bunch of different clinical studies and assess whether cannabis was effective or not. And the other was to explore the factors hampering the medical community use in the clinical practice of Parkinson's. The study evaluated 14 different studies. 5 were randomized controlled trials, also called RCTs, and 9 were uncontrolled studies. Now, the study results state that the positive effects on motor symptoms in 5 of the studies and non-motor symptoms in 4 of the studies that were described in the uncontrolled studies have not been confirmed by the few and small randomized controlled clinical trials. So what the authors conclude from their 14 available studies is that despite the increasing use of cannabinoids for PD, there's a lack of consensus regarding its efficacy and scope of adverse effects on the drug. So collectively, current data suggests that there's insufficient evidence for recommending the use of cannabis for motor symptoms and PD, and while its safety remains unclear. In another study in the journal Curious, that's Cureus, Pros and Cons of Marijuana in Treatment of Parkinson's Disease. They cite a study that demonstrated the effects of cannabis on 85 individuals with PD. Most of them consumed a half a teaspoon of cannabis leaves along with their prescribed pharmacological therapy for Parkinson's. So essentially, they were continuing to take their current medications prescribed by their doctor. About 46 of these people reported relief of PD symptoms in general, occurring in an average of 1.7 months after the first use, suggesting that chronic use of marijuana may be required for improvement in its symptoms. Bradykinesia was the most common symptom that was alleviated with cannabis users, followed by muscle rigidity at 38% and tremor at 31%. Additionally, 14% of patients reported improvement in levodopa-induced dyskinesias. It was also noted that higher urine levels of the metabolite of THC in individuals using cannabis for several months resulted in visual improvements in bradykinesia and rigidity. Now, in another study, marijuana compounds, a non-conventional approach to Parkinson's disease therapy that was published in the Journal of Parkinson's Disease, the study cites several studies with varying results. In one study, a participant smoked cannabis, and it was responsible for a significant improvement in the mean total unified Parkinson's disease rating scale score, which included tremor, rigidity, and bradykinesia. In 17 patients with PD, one dose of smoked marijuana provided symptom relief for up to 3 hours. However, smoked marijuana did not reduce Parkinsonian symptoms in 5 patients that had Parkinson's disease and also had a severe tremor. A clinical trial in 19 PD and 6 patients with levodopa-induced dyskinesia demonstrated that oral cannabis extract was ineffective for alleviating Parkinsonism or dyskinesia. So, in another study, CBD administration produced no improvement in measures of motor and general symptoms in 21 patients. One study noted that CBD withdrawal caused severe generalized dystonia, or unintended sustained muscle contractions. Now, if you never had dystonia, it's not a pleasant condition, so it might be something to try to avoid. All right, now that's a lot of different numbers and percentages, and you're probably thinking to yourself, your head's spinning right now, and you're probably saying, Chris, this is really as clear as mud. What am I supposed to do with all that information? Because you're talking about some studies that showed positive results, and then you're showing some studies that showed there's no improvement. So what do we do? Well, one of the things that I like to do is, and you're probably thinking to yourself, is it something I should ask the doctor to recommend or not? And I agree. So if you've ever watched the old show Dragnet, there was Detective or Sergeant Friday, and he used to say in the show, just the facts, ma'am, just the facts. So we're just going to try to get the facts. And so what I did to try to get the facts, I went to the leading Parkinson's foundations to get their take on the use of medical marijuana. And I started with the Parkinson's Foundation and their article, Medical Marijuana. In this article, they state that the literature on medical marijuana is incredibly varied. Studies have not clearly supported the use of marijuana for PD. The clinical studies of cannabis as a PD treatment that have been conducted are generally small studies that are predisposed to biases. Most of the studies have not followed the clinical trial gold standard of being a double-blind, placebo-controlled study. And then the article evaluates the risks and benefits for people with PD. Now, the benefits include a possible improvement in anxiety, pain, and sleep dysfunction, weight loss, and nausea. Potential adverse effects include impaired cognition, especially executive function or planning and judgment, dizziness, blurred vision, mood and behavioral changes, loss of balance, and hallucinations were all listed as potential adverse events. Researchers issue caution for people with PD who use cannabis, particularly because of its effect on your thinking. Parkinson's Foundation, in partnership with Northwestern University, studied attitudes about cannabis at 40 of their centers of excellence and who are members of their global care network. Now, this was the first study to provide data on the practices and beliefs and attitudes of expert PD physicians on the use of cannabis. Now, when I think of the word expert PD physicians, I'm assuming they're talking movement disorder specialists. One of the most interesting findings is that cannabis is a popular subject within Parkinson's Foundation centers, as 95% of neurologists reported people have asked them to prescribe it. That number really floored me. I didn't realize it was going to be that high. Other results that are very enlightening on this cannabis study include only 23% of physicians had any formal training on the subject of cannabis, such as a course or lecture. This 93% of physicians want cannabis taught in medical school, which I thought was very interesting. Now, in terms of memory, 75% of physicians felt that cannabis would have a negative effect on short-term memory, and 55% felt that cannabis could have negative effects on long-term memory. Only 11% of physicians have recommended the use of cannabis with their Parkinson's patients. The study emphasized that physicians would be more apt to use medical marijuana as a treatment if it was approved through a regulatory body versus a legislative body. This is because nearly all medications that are approved, and they're only typically approved after passing a science-based evaluation proving their effectiveness and safety in a process that's overseen by the FDA. Now, since cannabis has been approved through legislation, there's no labels, dosage recommendations, or timing instructions that physicians can reference. So I think they feel blind in how do I prescribe this? What dose do I use? What form should I prescribe? The Michael J. Fox Foundation hosted an online survey to learn about people's experiences with medical marijuana. And among 1,900 patients, 70% reported using medical marijuana, and many report small benefits on sleep, anxiety, and pain. But 13% weren't exactly sure what they were taking, and 30% didn't want to discuss it with their doctors. In their Medical Marijuana and Parkinson's Disease Guide from the Michael J. Fox Foundation, they state that if you're considering or taking cannabis, to let your doctor know. They may be able to help you with the pros and cons, and they'll work to give you a complete picture of all your treatment prescriptions and your current health status. That way they know if there is a change or an adverse event. Is it because of the medication, or is it because you were using medical marijuana? But if they don't know about it, they might assume that the adverse effect is related to one of the products that they prescribed. So what you want to do is ask your doctor what symptoms that medical marijuana may help. What are you trying to treat? Are you trying to treat sleep, anxiety, pain? The guide states that in general, cannabis seems more useful for non-motor symptoms, but experiences may vary. They also say that many doctors and researchers believe that marketing hype of cannabis products is way ahead of the science and evidence. They say to maintain a healthy dose of skepticism when considering medical marijuana. They say in general, when social media provides a level of endorsement significantly out of proportion to what you hear from your doctor, it's probably too good to be true. All right, now we've looked at some of the research that's available. Let's look at some of the potential benefits and then drawbacks to medical marijuana use for PD, specifically motor and non-motor symptoms. Let's start with motor symptoms, and we'll lead it off with tremors. Some studies suggest that medical marijuana may help reduce tremors in PD patients, particularly using CBD. And then moving on to the next motor symptom, which should be looking at improvements in rigidity and bradykinesia. According to the article, Medical Marijuana and Parkinson's Disease, Is It Safe? From everydayhealth.com. The article states that patients may find that it relaxes muscles and makes movement easier because one of the symptoms of Parkinson's is rigidity from tightening of muscles. Okay, so that's some of the potential benefits of medical marijuana on motor symptoms. Let's look at some of the potential benefits of medical marijuana on non-motor symptoms. And let's begin with pain management. Medical marijuana has shown potential in alleviating pain. It is thought because cannabinoids have anti-inflammatory properties. Next is improved sleep quality. Some studies suggest that medical marijuana may help improve sleep disturbances in people with Parkinson's, and that could include insomnia, restless leg syndrome, and others. The next is reduction in anxiety and depression. And what they say is that while more research is needed, there is evidence that suggests that medical marijuana may help manage anxiety and depression, which are common in people with PD. And then finally, appetite and nausea. It can help with appetite stimulation and reduce nausea. While there are a lot of potential benefits, clinical studies are often small and not always rigorously controlled, so you have to keep that in mind as well. All right, we've looked at the potential benefits of medical marijuana. Now let's look at the drawbacks or side effects profile. In their article, Medical Marijuana, the Parkinson's Foundation states that the following are potential adverse effects from using medical marijuana. Leading us off is impaired cognition, specifically executive function or planning and judgment. Dizziness, blurred vision, mood and behavioral changes, loss of balance, and hallucinations. Doesn't sound good, any of those. The article also says that researchers issue caution for people with PD who use cannabis, particularly because of its effect on thinking. Because PD can impair executive function, which is the ability to make plans and limit your risky behavior. People with a medical condition that impairs executive functions, like Parkinson's, should be cautious about using any medication that can compound its effects. Now, some other side effects that were noted include dry mouth and throat, increased appetite, which can lead to weight gain, and heart palpitations. It's crucial to weigh the potential benefits and risks of medical marijuana before starting treatment. So if you're considering medical marijuana for Parkinson's, again, it's essential to consult with your healthcare professional, and they can assess your individual needs and any potential drug interactions, because you don't want to have a drug interaction because they can cause some big problems. Now, before we move on to our final segment, I wanted to share an offer from audible.com. If you're not familiar with audible.com, it is your one-stop source for audio entertainment. They offer an incredible selection of audiobooks across every genre, from bestsellers to new releases, celebrity memoirs, motivation, wellness, and business. Audible also includes thousands of podcasts from popular favorites to exclusive new series. As an Audible member, you can choose one title per month to keep from their entire catalog, including bestsellers and new releases. Their Audible app makes it easy to listen anytime, anywhere, whether you're traveling for work or vacation, cooking dinner, or just going for a walk. New members can sign up for the free 30-day trial and get their free audiobook. Two audiobooks that I recommend are Lucky Man by Michael J. Fox and Happiness of Pursuit by Davis Finney. Now, to take advantage of the free 30-day trial in the audiobook, visit audibletrial.com/liveparkinsons.com. That's www.audibletrial.com/liveparkinsons.com. And I'll leave a link in the podcast description if you're interested. Now, for complete honesty and transparency, if you sign up for the free 30-day trial of Audible pays me a small commission, which I use to support this podcast. If you do decide to take advantage of the free 30-day trial, I thank you for supporting this podcast. All right, let's look at some considerations and concerns with the use of medical marijuana. Let's start with dosing and administration. First of all, how does someone use medical marijuana? Now, I have to be honest with you, having never used marijuana or medical marijuana, I was surprised at the number of forms that it's available in. And here they are. The flower. This is the most traditional form, consisting of dried cannabis buds. It can be smoked, vaporized, or consumed in edibles. Oil. Cannabis oil is extracted from the plant and can be administered orally, sublingually, or topically. Tinctures. These are alcohol-based extracts of cannabis that can be taken orally. Then you have edibles, which are food products infused with cannabis, such as gummies, chocolate, or baked goods. And then topicals. They're creams or lotions that can be applied directly to the skin for localized relief. Maybe it's knee pain, shoulder pain, back pain. All right, now that we know that there's a plethora of forms of medical marijuana, what are some of the dosing considerations that people need to consider? Well, first, dosing variation. The optimal dosage of medical marijuana can vary greatly from person to person. Factors such as your age, your weight, tolerance to the drug, and the condition being treated can influence the appropriate dosage. Next, as with most things, start low, go slow. So it's recommended that you start with a low dose and gradually increase it as needed to achieve the desired effect. Now, doctors do this with a number of medications, starting at a low dose, and then they titrate up until the patient gets the optimal benefit. That's also known as titration. Finally, tolerance. The body can develop tolerance to medical marijuana over time, and that just may require adjusting the dosage. Those are some dosing considerations. Now let's turn our attention to the concerns with medical marijuana, leading off with potency. The potency of medical marijuana can vary widely depending on the strain you get, how it was grown, and how they processed it. So it's essential to choose a product with known potency. Contaminants are another thing to be taken into consideration, and medical marijuana products may contain contaminants such as pesticides, heavy metals, or mold. So it's important to purchase from reputable sources. Next is legal restrictions. The legal status of medical marijuana varies widely by region. It's essential to be aware of what the laws are in the areas where you live. And then interaction with medications. Medical marijuana can interact with other medications, potentially leading to adverse effects, depending on the type of CBD that you're using. Finally, long-term effects. More research is needed to understand what some of the long-term effects of medical marijuana use are. So if you're considering medical marijuana as a treatment option, it's crucial to consult your healthcare professional. They can assess your individual needs and determine the most appropriate form, dosage, and administration method. All right, let's look at the regulatory status of medical marijuana in the U.S. At the federal level, it's considered a Schedule I substance under the Controlled Substances Act. So what this classification does, it indicates a high potential for abuse and no accepted medical use. So making its distribution a federal offense according to the article. Cannabis and Public Health State Medical Cannabis Laws by the Centers for Disease Control. Now at the state level, as of February 2024, 47 states, the District of Columbia, and 3 territories, Guam, Puerto Rico, and the U.S. Virgin Islands, allow the use of cannabis for medical purposes. Comprehensive programs at 38 states, D.C., and 3 territories have comprehensive medical programs that allow the use of cannabis products beyond CBD/low THC for medical purposes. 9 states have a CBD low THC program, so that might be there no more than 1 to 2% or 3% of THC in the medical marijuana you're getting, and that allows for the use of products for qualifying medical conditions. Now, there are a few states that have no public access. Idaho, Kansas, and Nebraska, and American Samoa do not have any legal cannabis programs. All right, we've covered a lot of information in this podcast, including the components of medical marijuana, which are THC, which is the psychoactive effect, and CBD, the non-psychoactive component. We looked at the statistics behind its use and the research on medical marijuana. We looked at motor and non-motor symptom benefits or potential benefits and found out that doctors want to learn more about the scientific research, dosing and administration, and side effects profile before really feeling comfortable recommending it or prescribing it. They expressed a need to have it discussed in medical school and in lectures. And we looked at the potential benefits and concerns with its use and the current regulatory status. We also learned that various Parkinson's foundations are recommending further research before recommending it for widespread use in PD. Now, here's your call to action. Consult your healthcare professional. If you want to know more about medical marijuana and if it's right for you, ask your doctor. They'll be able to assess your needs and let you know if it's something that is right for you. Advocate for further research. Support ongoing research into medical marijuana for treating PD, motor, and non-motor symptoms. This can be done by supporting relevant Parkinson's organizations and stressing the need to support further research. And then finally, explore resources. Visit reputable websites, join organizations that are related to medical marijuana, or read books that offer more information on medical marijuana and Parkinson's. Now, living with Parkinson's myself for a long time, I understand the daily challenges that we all go through with both motor and non-motor symptoms. The use of medical marijuana is a personal choice that should be made with your doctor to ensure it's appropriate for you and that it won't interact with your current medications and cause issues. Now, I hope I was able to provide some relevant information that sheds some light on medical marijuana and its potential benefits in Parkinson's disease. Now, my hope is that you're armed with information that you can discuss with your doctor so you get the best quality of life possible. No matter what your thoughts are with medical marijuana and whether it's appropriate for you, I just hope your Parkinson's journey leads you to living the best life each and every day. Thanks for listening. And before I close out, I have a request for you that you visit liveparkinsons.com and sign up for the free monthly newsletter. It's chock full of a lot of great information that can help you live a great quality of life with Parkinson's. In addition, after much discussion with friends and a little bit of trepidation, I added a new link to a Ko-fi page, which is if you want to buy me a cup of coffee because you feel like that the information that I provide is beneficial and is helping you on a daily basis, you can buy a cup of coffee, which helps support the podcast and the website, because the time and cost can become a burden and can have a detrimental impact on getting podcasts out or updating new articles and free resources on the website. So again, it's on there if you feel that I provide value that's helping you live a better quality of life. There's no obligation. I just wanted to share that with you. And I thank you for supporting this podcast. And I hope you have a spectacular day. And thanks for listening.